Hello, Dr. Torgerson, and hello to all our viewers who are tuning into our Ask the Doctor series. We've got a fascinating subject today. We're going to ask Dr. Torgerson, what on earth are laser gynecological treatments?
Well, hello. Yes, it's a topic that many of our clients are really shy to talk about, but gynecological issues so many women deal with can now be treated without surgery. So it's an exciting time to talk about it.
So why would you, a cosmetic aesthetic doctor, bring gynecological treatments into your practice?
Well, this is a massive growing portion of the aesthetic field, and a lot of women are looking for non-surgical and advanced ways to deal with gynecological issues. Much of the aesthetic technology that's available today provides an excellent treatment option. At my practice, we have gynecologists who help to treat our patients, so our female clientele can be assured that they're getting expert, knowledgeable advice and care with properly educated and trained specialists.
But for our viewers, can you break down some of the common intimate problems that women of all ages may face?
Well, many people are aware issues like vaginal dryness and atrophy can develop in menopause and make sex uncomfortable. It can cause much frustration, but even young women have to deal with things like stress, urinary incontinence, and weak muscles after childbirth too. So leaking can be triggered by everyday activities like exercise, laughing, sneezing, coughing.
So it sounds like a lot of these problems are related, the vaginal atrophy and urinary incontinence and discomfort and dryness, that they're all connected. I think it's really important to let our audience know that a lot of people suffer with this issue, right? There's an estimate that it's 1 in 5 women, and young women too, deal with this really frustrating problem, but you have a solution, right?
So that's right. In the past, surgical options to tighten the vaginal canal or attempt to repair incontinence were kind of the real only option for women.
And Kegels, but I've never managed to remember Kegels.
Right, well, Kegel exercises or exercises that are flexing the pelvic floor can help, but hormonal changes that take place can really alter elasticity and lubrication and more. So Kegels can only do so much, unfortunately. But we now have a non-surgical, painless treatment that are done quickly in the office, and they're getting incredible results. It's called Intimalaze and Incontinence, and they're both laser procedures by Fotona. This is really becoming the gold standard for this kind of technology. And there's also other aesthetic technology now that actually helps to tighten the pelvic floor, basically doing 1,000 Kegels for you in a matter of 20 minutes or so.
Wow, that's incredible. Now, the sound of vaginal lasers can be a bit intimidating for, I'm sure, a lot of our viewers. So tell us that it's not scary.
You know what, it's not scary at all. There is a wide variety of lasers that are used actually, but this one in particular directs all the heat energy below the mucosal surface. It's into the deep tissue, and with that, there's a stimulation of collagen and elastin. It's tightening the skin, it's thickening the vaginal walls, but it doesn't damage the surface.
Okay, so how do your patients describe the sensation of the treatment?
So our gynecologist uses this small handheld wand to apply the energy, and patients say it feels warm, sometimes maybe a little bit tingly or itchy, but definitely not painful.
Okay, that doesn't sound too bad at all. What can people expect from the treatment? How long does it take?
So it's only taking about 15 to 20 minutes. There's no downtime. Patients are basically treated in a comfortable private room with our female gynecologist, and they can just leave and return to their day immediately after the procedure. For good candidates, there's a much better fit for lifestyle and budget than a surgical solution. As for results, do you know what? It takes some time because essentially you're building up collagen and you're tightening mucosal tissue. The circulation to the area is increased, and then the tissue's changed on a cellular level to tighten the vaginal walls. One of the best side effects, if you will, is that sensitivity and lubrication increase. Some people report effects as early as a couple of weeks. 94% felt an improvement going strong at about 4 months, and 68% were symptom-free.
So how many treatments would someone realistically need to achieve that?
So it's generally about 2 to 4 treatments are usually what's recommended for the best results.
Wow, that's quite incredible. So it does sound like intimidase and incontinence can do multiple things and treat multiple symptoms all at the same time.
Yeah, it's true. They absolutely do. And it's a massive improvement in safe, non-surgical, intimate care for women. And it improves so many people's lives in so many ways. And our patients are often referring it and recommending it to their friends.
Okay, how can people get in touch with you and your office to learn more about this gynecological treatment?
Well, you know what? Our website is an excellent source of information, and you can call and you can schedule a free consultation with one of our expert gynecologists to get you the best result.
Thank you so much, Dr. Torgerson, for talking about this really important subject, because a lot of people suffer with this issue.
And make sure you like or subscribe to our videos online. Please tune in again. We'll see you next time.